Oh, my name is Mia Guerrero, and in this reflection, I'll be discussing what I learned from the needs and challenges of disaster. I'll be focusing on the needs and challenges during the heroic phase and the potential crash point in the honeymoon phase and the types of clinical symptoms that can arise during the disillusionment phase, along with the interventions that are most helpful. I'll also incorporate examples of emotional and spiritual care interventions across all of the phases. So the first is needs and challenges of the heroic phase. The first phase after a disaster is known as the heroic phase, and it typically happens when the first hours to several days after impact. In the video, this phase was described as a time when disaster survivors and even responders are fueled by adrenaline, urgency, and a strong desire to help others. So during this phase, people may experience heightened adrenaline and a sense of purpose, extreme energy, and pushing through physical or emotional exhaustion, unrealistic optimism, like everything's going to be okay or everything's under control, a sense of community bonding and feel good stories, and a great gratitude for survival and for those helping. Um, so, although these reactions can be positive, they create many challenges. So, the first challenge would be neglect of physical needs. So, people may forget to sleep or eat or rest. And responders and survivors both tend to push themselves beyond healthy limits, which increases risk of injury or collapse. Another challenge that they may face is impaired judgment. So because their adrenaline is so high, decision making can be impulsive or clouded by emotion. Another challenge that they face is lack of awareness. Survivors may believe that the disaster recovery will be quick or simple, but this is an unrealistic optimism, and it makes later stages of recovery more emotionally difficult. Um, and one of the last challenges that they might face is emotional overwhelm. So people often shift rapidly between relief, shock, and urgency. For responders, compassion fatigue can begin early if they're not supported. Um, so from the video, some of the key interventions include checking on people's basic safety and physical needs, helping survivors identify what immediate supports and resources are available, offering brief emotional um, stabilization, and praying for or with survivors if it's appropriate. And all these interventions aim to reduce panic, stabilize functioning, and strengthen immediate coping. So in the honeymoon phase and the crash point, it usually lasts several weeks after a disaster. And during this phase, survivors often feel hopeful and optimistic because help is arriving. Community agencies are responding, and there's a strong sense of togetherness. However, in um, the video explained that this phase can include a crash point. So, who experiences the crash? That would be the survivors, first responders, church-based helpers, and community volunteers. And when does the crash happen? It tends to occur when the initial wave of assistance, for example, emergency crews, donations, and media attention begins to fade. This transition can occur anywhere from several weeks to a few months after the disaster. And so, why does this happen? Well, it happens because the optimistic belief that everything will get back to normal quickly begins to fade. Survivors realize that recovery is going to take much longer than they thought, and financial loss is permanent or far worse than expected, and they might not have the same home, job, or routine again. And support from outside agencies, um, they begin to shrink, and they are more alone than they originally felt. So this emotional drop can feel like a betrayal or abandonment, and people may struggle with the loss of hope and experience a sudden emotional crash because their expectations don't match reality. And in the disillusionment phase, um, it's one of the most emotionally difficult phases. And in this phase, some emotions include fear, anger, hopeless, a sense of abandonment, questioning faith or purpose, exhaustion, loss of community support. At this point, people finally recognize that recovery is slow, complicated, and often unfair. According to the video, this is where survivors may feel hopeless, helpless, fearful about finances, angry, and overwhelmed. Some potential clinical conditions based on these stressors, survivors may develop acute stress disorder, post-traumatic stress disorder, major depressive disorder, generalized anxiety disorder, complicated grief, substance misuse, maladaptive coping, such as drinking, gambling, risky behavior, relationship conflict. So the best treatment approach is the video and disaster counseling literature highlights several evidence-informed interventions like CBT, trauma-focused cognitive processing therapy, CPT, and EMDR, eye movement desensitization, and reprocessing. These interventions help individuals process traumatic memories, challenge disordered beliefs, and reduce trauma symptoms. um, skills-based interventions. Um, this would include some techniques like grounding technique, anxiety reduction skills, emotion regulation, relaxation training, and another support would be community-based interventions. And that would consist of support groups, psychoeducation, church-based emotional and spiritual support, stress reduction events or activities. And there would also be burnout prevention for the helpers. So responders and church volunteers would need rest, rotation of duties, clear boundaries, debriefing and supervision, opportunities for spiritual renewal, and also long-term spiritual and emotional support. So the video emphasized um, to foster community over isolation, support post-traumatic growth, encourage hope in Christ, help survivors find meaning in suffering, um, and affirming spiritual resilience. So overall, this video made it clear that disaster recovery is not just about rebuilding homes, it's also about rebuilding emotional, spiritual, and relational systems. Each phase brings unique needs and challenges, especially for both survivors and responders. Understanding these phases allows helpers to provide the right kinds of support at the right times, whether through practical assistance, emotional stabilization, spiritual encouragement, or appropriate mental health referrals. So I have included some resources in my response. I used The Fundamentals of Crisis Counseling, one of our readings, Trauma-Informed Counseling, and the assigned video, which is Needs and Challenges of Disaster in Module 6. Thank you.